Is the Swedish healthcare system as bad as I heard it was when I lived in the United States? My name is Brandon. I'm a registered nurse from the United States, living and working in Sweden as a nurse. I came to Sweden almost 4 years ago. This August 2025 will be 4 years of living and working in Sweden. And I have 16 years experience as a registered nurse. I'm also a nurse practitioner, and I am certified as a certified diabetes care education specialist. Before I was a nurse, I worked in pharmacy as a pharmacy technician for 7 years. So I've got a pretty extensive background in healthcare. I've worked at multiple different hospitals, mostly within one hospital system. There was a hospital system I worked in Texas that included about 33 different hospitals. I also did some travel nursing and worked in Alaska, out in the middle of nowhere. And here in Sweden, I've worked in home health in one city, and now I work in a hospital setting. So I do feel like a little bit of an ambassador when it comes to speaking for what it's like in the healthcare system here in Sweden and trying to share this information with people outside of Sweden, because there are a lot of statements, a lot of myths, a lot of confusion, and a lot of people are really truly curious. And I've had a lot of people asking me so many questions. It's just easier for me to do a video to answer these questions. So today, I don't want the video to be totally anecdotal and just hearsay, but I did do a lot of research. I will include some source material that you can look at. There's actually a really good article that was brought about by help of the World Health Organization. There was research done in Europe and in Sweden, comparing Sweden to other healthcare systems in Europe. And so if you want to take a look at that, please do. So for the video, there are four main things that I kind of want to cover. I want to cover what people are saying on both sides of the ocean. I also want to kind of discuss what the actual literature is saying about the healthcare system in Sweden. I want to talk about my own personal experience, and then I also want to cover, kind of put a bow on it and say my overall thoughts about the healthcare system in Sweden, and maybe even a little dabble in American healthcare system, though this is mostly focused on healthcare system in Sweden. There will be a little bit of back and forth on these different topics, a little bit of mixing and matching. And before I get started, I would like to say thank you all that have subscribed. It's so cool to see the count going up on my subscribers. I must thank you all for that. And I want to say that I have just started up YouTube memberships on my channel. So if you want to support me even further and appreciate the material that I put out, feel free to check that out. I will be offering more features, more perks with time. Right now, I have one level for a minimal fee, and that level will give you access to different perks. So feel free to check that out, and I really do appreciate that. That being said, let's get to the video. So first off, let's talk a little bit about what people say about the healthcare system. So coming from the United States has been interesting because I did work in healthcare, and there were a lot of misconceptions about the Swedish healthcare system. And in the United States, when people found out that I was going to be moving to Sweden, one of the most common things was, you're going to move to one of them communist countries where they got that communist medicine. I also heard about long wait times. I heard about that care was not given to you if you were over the age of 80 because it's kind of like you've lived your life, and so you're just not going to get any good care after that. So there was a lot of those kinds of things. But it wasn't all negative. I didn't hear a whole lot of positive because I think most Americans have not actually experienced a healthcare system in Sweden. Most Americans, they're just basically an echo chamber repeating what they've heard, which is not any different from Sweden, because I've seen the exact same interesting phenomenon here in Sweden, because I do hear a lot of stuff about the American healthcare system. And usually on both ends of the spectrum, whether it's in the United States or Sweden, there may be some small little tidbits of truth, and things do get kind of embellished. Another interesting about human behavior is we do tend to sensationalize things. That's what the media does, because they want to get people interested in things. And so they over-sensationalize stuff, and people tend to dwell on the negative rather than the positive. So there was a little bit of some positive stuff I heard. I worked with a nurse who was in her 70s. She was technically retired, but she still loved doing what she did. She was an American nurse, and she loved to go and travel around the world with her girlfriends. So they go in their little group of, a bunch of 70-year-olds, and most of them had complex health problems by this point. They had diabetes, they had high blood pressure, or whatever else. And on one of these trips, they were going to Scandinavia to do some cruising and check out some of the cities in Scandinavia. And one of her girlfriends forgot her medications were in her check-in bag instead of her carry-on. And in the flight, her check-in bag did not keep up with her. And so she ends up in Sweden, in Stockholm, with none of her medications. She's insulin dependent, diabetic, has high blood pressure. She had multiple different medications she was on, and she's in a panic. And so they're like, okay, first thing we're going to do, we're going to go straight to the emergency room because, this is life-threatening. If she doesn't get her medications, she may end up dying. So they went straight there, and I heard nothing but praises about the health care that she received. The professionalism, the medications were cheap, the visit was cheap, and they kept going on about how handsome the doctors were. So that was the positive thing I heard. But like I said, most Americans have never been to Sweden, so they're kind of going off of what they've heard. Another thing that's an interesting phenomenon, going back to the whole communism thing, for some reason, there is this strong connection between socialism and communism. In America, I think what has to do with is there was a huge communist scare a long time ago, several decades ago, and I think that's kind of just stuck with the culture there. And for the general layman, they really don't understand what socialism actually means. And for all intents and purposes, Sweden is actually quite more complex than just simple socialism. There's also some monarchy going on here. There's a bit of some democracy going on here. There's a bit of capitalism. So it's an interesting mix, and most Americans don't understand that. And on the other side of the water, we've got here in Sweden, it's been very interesting to see the comments that I get on some of my videos when I talk about healthcare in Sweden. It's a kind of a mixed bag of comments that I get, and what's interesting to me is the sheer number of spicy comments I get from other Swedish people. And basically, what I hear from a lot of these spicy people is they don't want me to talk about healthcare. They think it's a non-issue, that Sweden has the best healthcare system in the world, and there are no problems in the Swedish healthcare system. Everything works just as it should. And I find this quite interesting because they are not the majority, but they are a significant number that are making these kinds of comments. What this kind of tells me is the Swedish people in general are probably very proud of the system, with good right. According to the literature, they actually have a very good healthcare system in general compared to other healthcare systems in the world. They should be proud of what they've put together. But to say that it's perfect and everything works exactly the way it should and it's the best healthcare system in the world is really kind of an ignorant and narcissistic comment, because when you go about things that way, you're going to be blindsided by stuff that comes up. And right now, according to the literature, there are a lot of challenges that are starting to come up in the healthcare system. Some of these things have been coming up for a while now, and now the Swedish people are having to figure out how they're going to tackle these things, and we're going to get into that. And I think it's important that we have these kinds of discussions, because if we don't have these discussions, then we can't improve. But generally speaking, I'd say probably 80% of the comments, they are pretty balanced comments from people in Sweden. I think there's probably more Swedish people per capita that actually have lived or traveled to the United States than the other way around of Americans have actually traveled or lived in Sweden. And it's interesting to see, too, there's a huge difference in comments from people that suffer from chronic health care issues versus those people that have been here in Sweden all their life and maybe not had any health care problems, or they've never really had any serious issues. I've also heard a few very scary stories of people that have gotten health care here. Now, it's very important. I take this very serious, me talking on a video like this, because I am a nurse. And my thought is, I don't want to scare people. I want the public to have full trust in the healthcare system. But at the same time, I think it's important to bring awareness to some of these things, because there's always room for improvement. And when there's issues with something, then something needs to be done about it. And I think that as patients, we have to be advocates for ourselves as well. We can't just completely trust in the system. In Sweden, one thing I've noticed is very different from America is a lot of responsibility is actually put on the patient. The patient has to figure out a whole lot of things. Whereas in America, a lot of it is kind of like a McDonaldization, where the doctors and all the healthcare people kind of, help you along the way to figure out, help you find a provider and help you get an appointment and all this kind of thing. Whereas in Sweden, there's a lot of, you just need to call this number and you get this pair of shoes from this people, so call this number and, that sort of thing. And for a lot of people, it's not really a big problem, but when you're talking about, say, older patients, that maybe they've got some, cognitive issues or things like that, then that can be a bit more of a challenge. So it's really interesting. And I think, like I said, this is very important that we talk about these things so that we can make good choices in our healthcare. Now, when it comes to what is the literature saying, we'll get right into that. The first challenge of 7 that I was able to come across was long wait times. Now, this is a very interesting one because I had heard this in America. I heard this really not just directed at Sweden, but just generally speaking against all healthcare systems in the Western world that have some sort of universal healthcare system, whether it was Canada, the United Kingdom, Sweden, wherever. And I think there's just a lot of fear in America of letting go that control and giving that over to the government. I think, here in Sweden especially, they have a lot more trust in the government than, say, Americans do in the government. And so, I think the Swedish people, they're very proud of what they've built here. They're very proud of this healthcare system. But there are some issues, and one of these is the long wait times. Now, why is there long wait times? Well, it's not in all cases. So I'll give you an example. I myself have been able to get health care relatively quickly, anywhere from 1 day to 2 weeks. And I know in the place that I work, we're usually able to see people anywhere from within 1 day to 30 days. That's the typical, and it just depends on how acute the situation is. It is really a challenge for us because of a shortage of resources many times. Maybe we don't have the staffing, or we don't have the appropriate people that have the knowledge. Like perhaps, in one case, we will need a certain type of doctor and it's summertime and we just don't have the staffing, and they're the only doctor that knows how to do this certain thing. And that tends to be one of the big reasons why sometimes you have long wait times, and that has to do with a shortage of specialists. So, like I said, in most cases, I was able to be seen within a week to 2 weeks, but there was an exception. So I ended up with some teeth problems. I had generally good oral care, I'd say average. And, I would go in for my teeth cleaning once or twice a year, but I do have braces to correct a serious bite problem that I had. I was told, you need to get braces, otherwise you won't have any teeth when you're older. And I had some interesting situations with some braces. So it was not purely cosmetic, but it was also a structural thing. And so then I came to Sweden during the pandemic because I'd had the braces for already a couple years and I wasn't able to discontinue them. I also had some wisdom teeth that I was told were very risky to pull out. They weren't infected. They weren't causing any trouble. And so they said that the risk outweighed the benefits of taking them out. And what ended up happening was, I guess because of having the braces, my bite changed a bit. And so then I ended up with a gap between the 2 wisdom teeth, and so then some cysts formed and I got some pockets, and so then I was going to have them removed. And I got one removed and it ended up turning into borderline sepsis. I went to the hospital. I was on many weeks of antibiotics, and it was just an absolute nightmare. I had a lot of complications. I was operated on by a really good dentist that was highly recommended to me. He's got really good reviews here in this county, and I was basically told that I was just unlucky. And because of all the complications that I had, and I dealt with months of complications, I was told I needed to get the other tooth out as quick as I could, but it was sitting right on a nerve. And then I was told that, first of all, it was really hard to even get to be seen by a specialist, by a jaw surgeon, which is what I needed, not a dentist. And so there was a lot of back and forth of, well, your dentist needs to send us a referral so that we can even see you. And then the dentist says, no, we don't do that. Your jaw surgeon that you're thinking about needs to send us a request for us to send them paperwork. And so it was like, this went on for about 4 or 5 months, back and forth of just, I couldn't even get an appointment. Finally, when I was able to get all that done and I kind of had to make a lot of noise, then I was giving a wait time of up to 2 years. And I was like, there's no way. I mean, are you kidding me? And so I called her, yeah, the wait is 2 years. And I said, I have pain. I've got a pocket that's 12 millimeters deep. I've got a cyst in there. I don't think it's infected or anything like that, but it needs to be taken care of as quick as possible. And so finally what ended up happening was I just had to keep making a lot of noise. And then I found someone that used to work at this department, and they reached out and got me an appointment within about 5 weeks to be seen. And as soon as I was seen and they looked at the tooth, they're like, yeah, this needs to be done now. So, there is that kind of stuff that happens. But overall, like I said, this is the only issue that I've ever had. Otherwise, like I've been in the emergency room and the care was good. Anytime I call and I say, I was having some heart issues last summer and I got seen like within a couple days. If you're actually having, say, a serious heart condition, like you're having chest pain or something like that, then of course they're going to tell you to go to the emergency room and get treated for that. If you're having stroke symptoms, they're going to treat that. So I think Sweden is really good in that regard when it comes to acute care. But when it comes to, say, something that's chronic health care or requires a specialist, there's just a huge shortage here in Sweden of specialists, and that's just the way it is. And I'm not really sure what the future is going to hold for that. It'll be very interesting to see, what the solutions will be to that. One of the things that I've heard recently is now there's becoming more privatization going on, and so some of these specialists are actually leaving the public healthcare sector and going into the private healthcare sector, which is making it even more of a challenge trying to get appointments with specialists. So really not sure what's going to happen in the future, but we'll have to wait and see. Second issue that the literature is showing is staffing shortages and burnout. Now, this is really not unique to Sweden. This is really a problem that can happen anywhere in the world. It's very interesting. I've been in healthcare, like I said, for many years now, over 20 years, and it's interesting to compare my experience with other nurses and doctors in other countries. And Sweden actually tends to be quite a bit better than a lot of the other places that I have friends and acquaintances in. But that being said, we still struggle with things like staffing shortages and burnout. And this is for many different reasons. I don't have enough time to go into that in this video about all that, but what I can say is it got so bad that last summer we had our first nursing strike in 16 years in Sweden. It was a big deal. And it was mostly not, there was a little bit of discussion about salaries, but really the focus was about nursing burnout. A lot of nurses are not able to stay in the career. Like I've met a lot of nurses that have actually gotten out of nursing and gone into things such as real estate or construction because they're just completely burned out. And a large portion of nurses are not able to work full time because they don't have the stamina to do it anymore. And these are not just nurses in their 60s. We're even talking about nurses in their late 20s, 30s, and 40s. And I have kind of my theories as to why this is. I can say that I personally have been struggling with being on the bleeding edge of burnout for quite some time. I did not really feel this in the States. In the States, I worked 3 days a week, 36 hours a week, and 12-hour shifts. And so I felt like I had more control of my life. I feel like here, your life becomes very much your job if you work in healthcare, which was interesting to me coming to Sweden because one of the big reasons I came here and chose it over a lot of other countries to move abroad. And like, if you want to know about my story about why I came to Sweden, feel free to check out my other content because I give the answers there. But yeah, I worked really hard. I worked in the intensive care. These are very stressful areas. My first job right off the bat out of nursing school was neurointensive. It was neurological surgical intensive care. You're dealing with brain surgery patients and brain tumors, and I'm like a brand new nurse right out of school, so there's a huge learning curve, and I didn't suffer burnout. I did have stress and anxiety and things of that nature, but here in Sweden, for the first time in my life, I'm dealing with burnout, and I don't feel like the workload is that heavy, honestly. I feel like the workload is a bit lighter, but I'm not really quite sure how to put my finger on it. And I think a lot of it has to do with the schedule, the 5 days a week, 8-hour shifts. And, healthcare is an interesting thing. If you compare a 40-hour work week to, say, another type of job that's not healthcare, let's say you're working at, and I'm not trying to demean people that work at IKEA, but say if you work at IKEA, no one will die because they got the wrong color of pillows for their couch. But you're working a 40-hour work week. No doubt you're working hard. You're lifting sofas, possibly if that's kind of your job description. But in healthcare, yeah, you're lifting patients as well, but these are living things. These are patients. These are living, breathing organisms, and life and death is in the balance, and it's very easy to make a mistake. You can make one mistake and you could seriously ruin a person's life or even worse. And so there's a lot of stress every single day. And I think that comes with time also. When you take care of patients for many years, you get to know them and you see them suffering with their things. There's also an emotional toll it takes, because you have to be emotionally supportive. So it's kind of like, being a caregiver to these people, it's tough. And we got into this kind of thing as nurses because we want to make a difference. We want to help, but it does come at a cost. And so I think being in the healthcare field is much easier to get burnout than, say, in a job where, you're dealing with maybe a machine, or you're dealing with a computer or things like that. Although burnout does exist in those areas as well. But I think it's much more easier to get burnout in the healthcare field. So I don't know what's going to happen for us. There was discussion about cutting down the work week to 36 hours a week. There's been all sorts of suggestions put out there, but I still currently am working 40 hours a week. 5 days a week. And I feel like my life is consumed by my job, because I'm kind of one of those people, I can't do, like, I see people, they're so good, they're able to go to work, and then after they get out of work, then they go to the gym, and then they go for a run, and then they cook dinner, and then they do this and that. And I'm like, I can't do that. One of the reasons, besides wanting to take care of people and help them as a nurse, that I chose to be a nurse in the beginning was we worked 12-hour shifts. 3 days a week. And so usually what I would do is my whole day was dedicated to work, and I had already meal prep for those 3 days. And, then I had 4 days off. I could do art. I could go to the gym on those days. I could sleep in as long as I wanted to. I could go see my family. I could take short little vacations. If I worked 3 days at the beginning of one day at 1 week and 3 days at the end of another week, I could go travel pretty far and come back and not even having to take vacation time. And I actually have done the math, and I found out, because of that 4-hour difference, that actually in America, we as nurses end up working about the same amount as nurses in Sweden, even when you consider the minimum of 5 weeks vacation compared to, say, a 2-week vacation in the United States. So I've found that pretty interesting doing the math. So yeah, don't know what the future is going to hold about that, but that is one of the big challenges that we're having here in the healthcare system in Sweden. And the third thing is a challenge when it comes to disparities among the different regions. So Sweden, last time I checked, Sweden is divided up into, I think it's about 21 regions. And then those are divided up as well into smaller groups, smaller areas. And so you have hospitals in those areas, you have different resources. So you'll belong to that region, you'll belong to, a healthcare system there, and you'll have your primary care doctor and all that sort of thing. But the farther north you go, the less resources that you have. Understandably, people want to live here in the south of Sweden, where it's more sunny and the weather's not as harsh. And so because of that, you're going to have more sources down here in the south. But then as you go up further north, then you're going to be met with more disparities. Fourth issue is aging population. And this is not just something that Sweden is dealing with. This is a situation really that's going on everywhere in the world. But what's interesting about Sweden is the long lifespan. So Swedish people have a longer lifespan than in the United States, for example. And the longer you live, the less that you're working compared to the amount of time that you're on retirement. So as you're on retirement, you're actually, drawing from the pool of money, and you're going to be requiring healthcare services for a longer period of time. On top of that, you also have the fact that you're going to have more risk of complex healthcare issues. So whereas back in the day, you may have passed away at a younger age before you were able to get a whole lot of different healthcare issues. Now, the longer you live, you could end up with maybe 3, 4, 5 major issues. You could end up with not just diabetes, but maybe heart failure, and you could end up with kidney failure, and you could have, Alzheimer's or whatever. And so all these things combined take a toll on the healthcare system. And in the end, money is important, and it takes money to care for the aging population. Another thing is people don't have as many children as they did back in the day. And, the young people that are coming in, that are working, they're supposed to be putting money back into the system that will be helping take care of, the aging population, basically. And so it's interesting to look at other countries that are really suffering from this, such as, for example, in Japan. It's a really big problem. And we're not in that kind of a situation here in Sweden, but it is definitely something that people are talking about. And the fifth thing that the literature is showing is a difficulty with digital integration. I was actually quite surprised when I came to Sweden, because I came from the United States, where I was used to everything being on the computer. I never used paper. We didn't fax things. I had heard about it. I had read about it in school, and I learned, how you would do something like that. I'd seen examples of it in the textbooks, but because of certain laws, mostly from having to do coming down from the government and insurance companies, we had to go over to a computer system, and it was so much more convenient. So the nice thing was, for example, if I had a patient come to me and they were unconscious and there was no family, I could access the pharmacy records and I could see like what kind of medications they were on, so that I knew what we needed to start up for them. Like if they were a seizure patient and they're on seizure medicine, then we knew that that was probably something that the doctor may need to start up a prescription for. Whereas in Sweden, there is a little bit of that to some extent. There are some systems, like here in Sweden, there is actually a system where you can look up medications and things of that nature, but it's still quite siloed. And so not all the systems are communicating with each other. There is a lot of paper. There's a lot of faxing of like prescriptions for stuff. For example, if someone comes into the primary care doctor and they have a wound on their foot, they will fax over something to the foot department, and then the foot department will look at it, then they'll assess it, then they'll figure out when the person's going to be seen. And so there's like this whole chain that has to be followed, and the paper I feel like slows things down. Whereas if it was electronic, I think it'd be a lot more efficient. You also think about, for example, patient data. It's much easier to have paper end up in the wrong hands. And I think about that with faxing. So we have a whole lot of processes in place to make sure that we don't fax anything to the wrong place. We have to call ahead and confirm the fax number, and then we fax it, and then we have to call back and make sure that the fax ended up where it was supposed to go, that sort of thing. And that takes a lot of time, and it's not effective, it's not efficient. But I think it's changing. The issue that we're dealing with is there's a lot of pushback. So, that's just human nature. We had this problem in the United States as well, that when there's something new that's coming out, people don't like change. They don't want to learn a new thing. And so they have to have pressure that comes from the higher ups, the powers that be, that says this is the way it is, and so we're going to have to do this. One of the other things that I've heard too, I've heard a lot of complaints about the digital systems that are being discussed about being implemented here in Sweden. And I've even been attacked as an American saying, it's a system from your country. And I'm like, okay, well, there's good charting systems and there's bad charting systems, and you really get what you pay for. I worked in Alaska, and the charting system we had was the worst charting system I've ever seen in my life. It was horrible. So you can't just say, well, because the system that we're getting is difficult to use, that all charting systems are bad. And, how much of that is just the fact that, it's a learning curve. We'll have to see what the future holds about that. But there is a lot of pushback. One of the big things that they're wanting to implement is using like a dictaphone where you actually talk and do your charting. And a big problem that we have here in Sweden is the fact that many of the people that work in healthcare do not come from Sweden. And so we have accents like myself. And so there's a concern about how difficult it is to be able to talk with a dictaphone and do your charting that way, rather than recording your voice and having a secretary go behind and type out what you've said. Sixth issue is mental health deficits. So here in Sweden, there is a big need for mental health help and support, and there is just a lack of resources for that. And it's mostly, the data is showing the big challenges with the younger people. And I'm not going to go into a whole lot on this video. I think if y'all are interested, I could do that in another video. But that is one of the things that the literature is showing. And the seventh issue is financial pressure, of course, which kind of ties in to a lot of these other issues. So, Sweden has about 10.5 million people, which is actually smaller than some cities in America. The whole population of the whole country of Sweden could fit in some of these metroplexes that we have in the United States, say, like if you think of Los Angeles or the Houston metroplex area, or maybe New York City. And so you don't have a huge pool of money to be delving into to address these things. A huge number of this population has come to this country from other countries, and many of them don't have jobs yet. They haven't gotten integrated into the system. They haven't been paying into it, but then a lot of them come here to this country from underdeveloped nations. And so because of that, a lot of them did not have access to good healthcare where they came from, and they come here with very complicated healthcare issues, and they need to be taken care of. And so all that is costing something. And then we had the COVID pandemic, which was a huge impact everywhere on this planet, to healthcare systems. There has been a lot of talk about different ways that we can cut back on spending on things. And so we've had a lot of these kinds of discussions where I work. So what are my thoughts overall? I think overall it's a awesome system. I think the United States has a lot they can learn from Sweden. I think Sweden, though, is not a perfect system. You will never find a perfect healthcare system anywhere on this planet, but I think Sweden has a lot to be proud of. They've built some really good things. It's awesome that you don't have to be worried about, going bankrupt to get healthcare. One of the common things I've heard in Sweden about healthcare in America, though, is that we will not take care of a patient if they don't have insurance. In doing the research, I was kind of interested when I found out that actually only 10% of Americans don't have insurance. Over the age of 65, I think a lot of Swedes don't understand this, that over the age of 65, then you got Medicare. We have people that have Medicaid that are poverty level. I did grow up in a family that was poverty level at periods of times, and we never had insurance. We never had access to dental care. You can get those things. No one's going to refuse taking care of you. It comes down to an ethical issue. As a nurse, I took care of people that were homeless. I took care of prisoners. We had frequent flyers, we call them, that were homeless people that maybe had diabetes and they were constantly ending up really sick and ending up in the ICU, and we never refused them care. But that's a whole nother thing. That's a whole nother animal, and it's a lot to unpack. And I'm not going to do that in this video because this video will go on for days if I were to do that. But that's just to kind of illustrate that it's very easy for you to just hear, like in America, we say Joe, Billy, Bob, what he told you about, the Swedish healthcare system, and he doesn't know anything, hasn't researched it, never been to Sweden, never experienced it. And then over in Sweden, you may have, Jan Oka or, Gumbrit saying, she saw on some, TV show that, in America, they don't take care of homeless people or something like that. And so you just have to do your own research. You need to look at the data. And I think, like I said, both systems have stuff they can learn from each other. For example, in America, we have some really cool technology that is life-saving and protective to patients that I have not seen as much here. I think that's changing. I was really impressed when I went to the intensive care here in Sweden. I did some shadowing, and I saw, because it's a brand new ICU that they just built here in Malmö. And it was such a nice ICU, better than any of the ICUs I've ever worked in the United States, like a hotel. I mean, it was really cool. And I saw that they were starting to purchase certain types of items that are made in the United States or in other Western countries. And it was things that, I'd seen that we've been using for years in the United States. One thing coming to mind has to do with storage of medications. Something that I was used to for a long time in the United States. I worked in pharmacy before I was a nurse, and all the medications were actually stored in an automatic dispensing machine. It was very secure, especially with narcotics, so it was very hard to steal drugs. And it also had a lot of things in place to make sure that you didn't give the wrong medication to the wrong patient at the wrong time in the wrong way. And those systems have developed and evolved with time in the United States over the years. So they've made more and more systems such as, you scan a patient's armband with a barcode, then you scan the medication. And, if it's the wrong medication, then you're going to get an alert on the computer and it won't let you give the medication. And yeah, just so many things like that I think it would be really cool to be able to see normalized in the healthcare system here. And I think it will come with time, but a lot of it's going to have to do with, the money that's paying for these things in Sweden is coming from the tax dollars. And if there's not enough tax dollars in the pool, then it's very hard to implement these things. And so they have to come up with other strategies to prevent, problems. But like I said, overall, Sweden is a great system. I'm very happy to be able to utilize the system. You will always have horror stories. It doesn't matter what country you live in. And I think that's really important for me as a healthcare worker to be very careful what I say on this platform, because I even know myself, I deal with anxiety. And so I even have anxiety going to the doctor. And so for a person to come on here and just start talking about all the horrible horror stories and negative stuff on here, for a person that watches that and is seeing that, it can make it even harder for them to go, to a doctor and get a visit. So one has to weigh these things very carefully, but at the same time, we can't just gloss over things. We have to bring attention to room for improvement. We all have room for improvement. So those are just my thoughts, and I hope this was information that is helpful to you guys and answers some questions. If you got more questions, please leave it in the comments section. And you don't have to be a member on my YouTube channel to support me. You can do something that costs you nothing, and that is to like and subscribe. And like I said before, I really appreciate you guys so much, and you'll have a great, wonderful rest of your day.